some sort of symptoms in a patient. We had a little mix-up with the MRI place that we send people to, and sent someone out for a left hip MRI that they end up doing the right hip, so we'll have to send the person back. The patient was having some pain, discomfort in the left hip after an accident, but with the right hip, pain-free, no symptoms, orthopedic tests are negative, and ranges of motion are all fairly normal. But get the MRI back of that right hip that they accidentally did, and you see some things on there. And what I wanted to discuss today is, when you send out, when we're talking about damage, that tissue damage that may show up on imaging, you always have to be ready to correlate clinically, because you're going to see things sometimes that may have nothing to do with why the person is there, and it may have no bearing on the outcome or anything like that. So we get this right hip MRI that we didn't order, and on that MRI we see a tear of the labrum from A to P on the superior side, about 2 millimeters. We see gluteus medius grade 1 strain with gluteus medius and gluteus minimus tendinosis. And it's just important to always remember that that doesn't necessarily mean that the person is having problems with those areas. And there's lots of things going on under the hood that never reach that threshold level of consciousness to your body to interpret it as some sort of pain or issue in the area. So, just always caution when you're looking at imaging, not to try to draw too many causation with a patient. You have to make sure that anything you're discussing is always kept in the context of, these kinds of things are seen in people with pain. These kinds of things are seen in people without pain. And you may even see people with pain that have no damage when you image. So it's always, you just always have to be, correlating that clinical history evidence, exam evidence with what you're seeing on imaging, and don't let people get too caught up in the aspects of imaging that might come back to you that kind of aren't relevant to the case. So I hope that helps you guys a little bit, and as always, check out the rest of my channel for more information, and see you next time.